Hey everyone, Dr. Raf here. Today, I want to talk about something that's often overlooked but incredibly important. How the medications you take every day might be impacting your brain health in ways you don't expect. Have you ever found yourself forgetting where you put your keys, struggling to remember names, or just feeling mentally foggy? If so, you might have wondered if your medications could be playing a role in these changes to your memory or brain function. Recent research is shedding light on a surprising connection. Some of the most commonly prescribed medications may actually be doing our brains more harm than good. We're talking about side effects like memory loss, difficulty concentrating, and even an increased risk of developing dementia over time. These aren't just rare cases. Millions of people could be affected without realizing it. Now, I'm definitely not saying you should stop taking your medications on your own. That can be dangerous. But it's absolutely crucial to be aware of these potential risks, and to have open, honest conversations with your doctor or pharmacist about your prescriptions and any changes you notice in your thinking or memory. In this video, we'll break down 9 types of medications that have been linked to cognitive decline. I'll explain what the research says, who's most at risk, and, most importantly, what steps you can take to protect your brain health while still managing your other health conditions. Let's get started and empower ourselves with the knowledge to make the best choices for our minds and bodies. 1. Anticholinergics. First up, anticholinergics. These meds block acetylcholine, a key brain messenger for memory and learning. They're used for things like overactive bladder, allergies, and Parkinson's. Think Benadryl, hydroxyzine, scopolamine. Studies show a strong link between anticholinergic use and increased dementia risk. One found a 54% higher risk in older adults. If you're on these long-term, talk to your doctor about safer alternatives. Don't ignore the risks. Your brain health matters. Stay informed and proactive. 2. Benzodiazepines. Let's talk about sleep aids. Benzodiazepines and Z-drugs like Valium, Ativan, and Ambien. They boost GABA for calm and sleep, but also suppress brain areas needed for memory. The result? Impaired memory, daytime drowsiness, and higher risk of cognitive decline. If you're struggling with sleep, ask your doctor about non-drug options like cognitive behavioral therapy for insomnia. There are safer ways to get quality rest. Protect your brain while you sleep. 3. Antidepressants. Antidepressants, especially older tricyclics like amitriptyline and doxepin, can affect memory due to strong anticholinergic effects. This is especially risky for older adults, increasing confusion and memory problems. Newer antidepressants like SSRIs and SNRIs are generally safer for your brain. If you're worried about side effects, talk to your doctor about switching. There are options that protect both your mood and your mind. 4. Antipsychotics. Antipsychotics like risperidone and olanzapine are sometimes used for agitation and dementia, but they can worsen cognitive decline and increase stroke risk. These drugs blunt thinking and movement by blocking dopamine. Always explore non-drug approaches first. Behavioral therapies and environment changes can help without added risk. Work closely with your doctor to find the safest plan. 5. Opioids. Opioids like oxycodone, hydrocodone, and morphine are strong painkillers, but long-term use can lead to dependence and cognitive problems. They suppress the nervous system, reducing blood flow and oxygen to the brain, which can cause memory issues and even brain shrinkage. If you're on opioids for chronic pain, discuss alternative pain management strategies with your doctor. Physical therapy, acupuncture, and mindfulness can help reduce reliance on these meds. Protect your brain while managing pain. 6. Antihistamines. First-generation antihistamines like diphenhydramine and chlorpheniramine relieve allergies but can cause drowsiness and brain fog by blocking histamine in the brain. Newer antihistamines like loratadine and cetirizine are less likely to cause these side effects. Check your allergy meds. Choose options that keep your mind clear. Stay sharp, even during allergy season. 7. Beta blockers. Beta blockers, such as propranolol, are used for blood pressure but can cause fatigue, depression, and memory problems, especially in older adults. They block adrenaline, which affects alertness and memory. Not everyone experiences these side effects, and newer beta blockers are more selective. If you notice brain fog or mood changes, talk to your doctor about alternatives. Your heart and brain health should go hand in hand. 8. Statins. Statins are widely prescribed medications that lower cholesterol and help protect your heart from dangerous blockages and heart attacks. For millions of people, they're a key part of managing cardiovascular risk and improving long-term health outcomes. But there's ongoing debate about whether statins might affect memory or cognitive function. Some people report feeling foggy or forgetful after starting statins, while others notice no change at all. It's important to know that your brain actually needs some cholesterol to function properly. Cholesterol is a building block for brain cells and helps with communication between nerve cells. Lowering cholesterol too much, especially in people who are sensitive, may potentially impact nerve function or the way your brain processes information. Some studies have found a possible link between statin use and memory issues, such as forgetfulness or confusion, especially when starting the medication. However, other research shows no effect on memory, or even suggests that statins might protect the brain from decline in some people. The scientific community hasn't reached a clear answer yet. If you have concerns about memory or side effects, talk openly with your doctor. They can help you weigh the benefits and risks based on your personal health history. Don't stop taking statins on your own. Work with your healthcare team to find the right balance for your heart and your mind. Stay informed, ask questions, and be proactive about your health. 9. PPIs. Proton pump inhibitors, PPIs, like omeprazole and lansoprazole treat heartburn, but long-term use can lead to vitamin B12 deficiency, raising dementia risk. Older adults are especially vulnerable. If you're on PPIs long-term, ask your doctor about checking your B12 and possible alternatives. Don't ignore persistent heartburn, but protect your brain too. Smart choices keep both your gut and mind healthy. We've covered a lot of important information today, and remember, the purpose is to empower you with knowledge, not to scare or overwhelm you. Understanding how your brain and body work together is the first step toward making informed decisions about your health. Never stop taking your medications without first consulting your doctor. If you notice any changes in your memory, thinking, or mood, don't hesitate to bring them up. Open communication with your healthcare provider is essential for your well-being. Ask your doctor about safer medication alternatives, possible dosage adjustments, or even non-drug approaches that might work for you. Your questions and concerns matter, and your doctor is there to help you find the best path forward. Remember, healthy habits like regular exercise, balanced nutrition, quality sleep, managing stress, and staying socially connected all play a vital role in supporting your brain health. These lifestyle choices work hand in hand with proper medication use to keep your mind sharp and resilient. Every day you have the power to make choices that protect and strengthen your brain. Even small steps, like choosing a healthy meal, going for a walk, or reaching out to a friend, can make a big difference over time. Subscribe to Dr. Raf for more practical health tips and guidance. Your journey to better brain health and overall wellness starts right now, one informed choice at a time.